Hello. Here, we'll take a look at movement disorders. At first, what we will do is, under the category of movement disorder, we will then organize our thoughts and think of it as being either hyperkinetic or hypokinetic. Under hyperkinetic, tremors, chorea, dystonia, myoclonus, tics, and stereotypical movement come under the category of being hyperkinetic. Now, is it possible the patient might be then exhibiting both hyper and hypokinetic simultaneously? Very much so. For example, an example of a hypokinetic type of disorder, such as Parkinson, could show you that shuffling gait, hypokinetic type of disorder, but then could also have resting tremors. Elements of both categories of movement disorders. Is that clear? Our topic continues with discussing tremors in greater detail. Under tremors, you would have different types. And the different types or behavior patterns of your tremor would then clue you in that a particular diagnosis should be thought of as being your high differential. For example, I want you to think of the motion or the action or intention of going after a cup of coffee or a mug of coffee. Let's say that the tremors that exist here, which are going to be the shaking, jerking movement of, let's say, the hands, is taking place prior to going for the coffee. So meaning to say that at rest, there were tremors taking place of the hand. You should be thinking about Parkinson, for example. But when you're actually going for the cup, at that point, intentionally, the tremors at that point would be, well, if not halted, then maybe subsided. And partial. A partial type of tremor would be more or less a central tremor, would be the most common, meaning to say that the cause here would be more or less idiopathic. And you have action type of tremor. An action tremor in which you have these jerk-like movements of the hand. Well, at rest, once again, you're going for that cup or that mug of coffee. But this time, at rest, your hand is more or less stable, and it's not moving. But then upon intention or action of needing to grab that cup of coffee, it is at that point when you grab the cup in which maybe the tremors would set in, and you're having these tremors and perhaps spilling the fluid all over the place. There's a difference between an action tremor versus a resting tremor. And when you're thinking about an intentional or action tremor, you then should be thinking that, okay, well, is there some type of an injury or lesion taking place in the cerebellum? Continue our discussion of hyperkinetic movement disorder. We now move on to chorea. By definition, chorea would be involuntary, abrupt, irregular movement of the body from one to another. So here you have this flow-like movement that's taking place from one part of the body to another. And here, for example, something that you might find with Huntington disease. The causes of chorea. Well, you've heard of CAG as being your trinucleotide expansion and anticipation. And if you start having damage taking place with the basal ganglia, then Huntington's disease should come into play. If you have a patient, and we'll deal with this patient later on, or we will address this patient later on, in which around the iris you notice a particular type of observation. And this is then known as a Kaiser-Fleischer ring. And here with this patient with such copper disease or a copper transport disease, Wilson's disease, may also cause a movement disorder such as chorea. Drugs, such as neuroleptics or even perhaps dopaminergic type of medications. Toxic, ethanol or alcohol, carbon monoxide or thyrotoxicosis may then bring about chorea type of movement. Remember, an involuntary jerky flow-like movement from one body part to another. Immunologically, SLE may be post-streptococcal, pregnancy-related, and perhaps even vascular when you have these penetrating blood vessels down deep subcortically. Remember, we talked about this in terms of lacunar infarcts, in which if the basal ganglia has been interrupted, then it may result in chorea type of movements. Here we'll take a look at another hyperkinetic movement disorder, and here we have dystonia. With dystonia, this would be sustained muscle contraction that's taking place, leading to repetitive twisting movement, abnormal posturing. It may be focal, and by that we mean blepharospasms. Think about your eyelids, spasmodic, dysphonia, or it could be torticollis, rider's cramp. Those would be more or less focal versus it being postural, segmental, or perhaps even generalized. The causes of dystonia would be perhaps idiopathic, symptomatic, well, with symptomatic maybe being primary versus secondary. With primary, idiopathic, something called torsion dystonia, would be an inheritance pattern of autosomal dominant. Whereas that which is secondary, once again here, you can have the common suspects or usual suspects of diseases that may result in damage taking place to the basal ganglion region. Once again, Huntington, Parkinson, maybe anoxia, stroke, or drug-induced type of movement. At this point, it is of utmost importance that you understand the definitions of these type of hyperkinetic disorders. Here we have myoclonus, yet another hyperkinetic movement disorder. A sudden, lightning-like movement produced by abrupt and brief muscle contraction. So I need you to compare myoclonus versus dystonia. Myoclonus would be extremely quick in nature, but still would result in a muscle like a contraction, or clonus, and myo referring to the muscle. Causes or types of myoclonus include, that could be physiologic, and by physiologic maybe it's jerk or even hiccups taking place. Essential, epileptic, primary generalized epilepsy. We've heard of myoclonus type of epilepsy, and that's something that we've also discussed. Symptomatic, metabolic encephalopathy, hypoxic brain injury, or Wilson's disease. All different causes and types of myoclonus. For the most part, if you wish to manage your patient with myoclonus, you want to slow things down. You're thinking about a benzodiazepine such as clonazepam, or perhaps even an anti-epileptic known as valproate or valproic acid. You've heard of Depakote. A hyperkinetic disorder here known as your tics, abrupt, stereotypical, coordinated movement, or perhaps even vocalization. Can be voluntarily suppressed if the patient has enough awareness of this particular issue taking place. And suppression causes anxiety. The tics relieve the anxiety is the theory that you want to keep in mind when dealing with tics, a hyperkinetic disorder. A hyperkinetic disorder in which we refer to as being Tourette's syndrome, it's a genetic disorder. Must have both vocal and motor tics for diagnosis. And what do we mean by a motor tic? A tic would be a coordinated movement that's taking place of the muscle. So we have motor and both vocal type of issues taking place. There's something called the rare, but we have something called coprolalia, is rare in Tourette's. It's associated with obsessive compulsive behavior and perhaps even your ADHD. The management of tics. Here, remember the dopamine has a number of pathways. And here you're trying to control the movement. And so therefore dopamine antagonists seem to be most effective in management of tics. Clonidine may be helpful as well.